What matters to me is the love and the eye contact and the genuineness of people.
I want them to know who I am, not what disease am I, or what age am I, or how tall am I.
It's important that I can stay with my mom.
What matters to you is about knowing our patients. And you have to have that starting point in order to begin working as a team.
I think it establishes a relationship, and the relationship needs to be one of a partnership.
Those questions get asked in a number of different ways. I might ask, what makes a good day for you? Or what are you most proud of? Or what matters to you? What gives you hope? What gives you courage? And in those conversations then, what matters to them comes out over and over again.
I introduce myself. I go into the room and say, my name is Joe. I'll be your nurse for today.
You need to maintain your eye contact with a smile. Come in gently into the conversation.
It helps when people are friendly.
Congratulations, it's exciting to hear that you're pregnant.
Thank you.
Now, when looking at your prenatal care, you have several options from an obstetrician, a family doctor, or a midwife. In order for you to make that decision about how you want your pregnancy managed, I need to know what matters most to you.
I think because this is my first baby, what matters most to me is having
The bedside whiteboard is probably the best tool if it's a matter of a patient request on how they would like to engage in their care and discharge planning. The bedside whiteboard belongs to the patient and family, should be written in language that they can interpret very easily, and should be reflective of the conversations we're having with our patients.
When we do our huddle, we bring the team, including family, but family is part of the team, so we share stories, then we compare different perspectives, then we gain a fuller understanding of what's going on.
Most places where residents live have care conferences. We start off our care conferences by asking the resident themselves, what's important to you, what are your concerns, or what would you like to bring forward to the team? The families come to the care conference and they're very good advocates for their loved ones.
Ask my opinion, please.
I don't jump in. I ask open-ended questions. I allow them to share as many, if not all, their feelings and their thoughts so that they can get them all out. Another really important part of listening is to be empathetic and to show compassion.
I think you should just pretend it's your own grandma, grandpa, or your mom.
What I think is really important for doctors that they have that curiosity and that interest in the patient.
Sometimes when it's delving into that emotional aspect of the patient, we're treading on territory that we may not always be comfortable with, but it's one that needs to be explored in order to truly provide a trusting, caring relationship with your patient.
Often people feel overwhelmed because they feel they have to solve that problem, right? So you're not going in there to solve that problem. You're going there to understand, to listen to that problem.
I understand that your mom had a fall the other day and unfortunately broke her hip.
Yes, it was so, I don't know how she's done it, but she stumbled and fell off the stairs.
Yes, so there are options for you, and one of them would be like surgery, or we could keep her comfortable just with some pain medications. And I'm just wondering what you being able to speak for your mom, what would she want?
My mom would like to have her life back, so whatever it takes to get her life back to normal.
I want to provide the kind of care that I would like to receive, and I want to give them whatever they need. And if that's a talk, instead of pushing my therapy all the way to the end, then it'll be a talk sometimes. If they're maybe just angry that they don't have a toothbrush, then I might just go get one.
Perhaps the client themselves used to be a very active person, so we provide that person with as much opportunity for them to be active.
An idea of something I thought would be fun for my husband and I to do. He had dementia. I called it a spousal sleepover, and she was happy to go to her administration in Vancouver and talk to them, and finally it happened. And he liked those, and I did too.
Shift reports and care plans are constantly being updated to ensure that the care is consistent with our clients. Lots of verbal communication between team members is also essential.